So if you've been having itchy and irritated eyes, it could be caused by a couple different things, but most commonly it's caused by eye allergies. And whether you're having seasonal allergies such as in the spring and fall, or perennial allergies that happen more year-round, here are a couple tips that are going to help you out. Let's take a look. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eyes and vision. If you're new here to the channel and you like taking care of your eyes, consider hitting that subscribe button down below so you don't miss any of our future videos. Now today we are talking all about eye allergies. And again, eye allergies is pretty much the most common cause of eye kind of itchy symptoms, things like that. When your eyes are exposed to an allergen, either in the air or touching the eyelid skin itself, then it causes what's called a histamine response. Histamine in the tissues causes your blood vessels to dilate and expand, making things look puffy and swollen, as well as leaking fluid from those blood vessels, and that fluid will also cause kind of a swelling appearance. In addition, your eyes will feel itchy, they'll seem red, and they'll be really dry and kind of irritated. And oftentimes people get a watery discharge coming from the eyes during the same response. And during an examination, when your eye doctor looks at your eyes, we often see these little raised bumps on the inside of the eyelids that we call papillae. That's oftentimes a big kind of a sign that someone is having an allergic reaction. Now, my first tip for eye allergies is to try to avoid whatever it is you're allergic to. Now, if you're somebody who's allergic to pollen and grass in the spring and fall, can be a little difficult because we don't have control over the seasons, but knowing that, hey, your neighbor's mowing their lawn, perhaps shutting your windows would be a smart idea. At the same time, we all know that we love our pets, and a lot of pet dander can cause allergic reactions. I know we don't want to get rid of our pets, but for some people, if it's really extreme, that might be a harsh reality that they have to make a decision over. Otherwise, a great thing you can do is to clean your eyelids regularly to avoid those allergens sticking onto your lids and lashes. So whether you're cleaning your face with soap and water just on a daily basis, or you're using some sort of a special eyelid cleanser, whether that be a cleaning solution or you're using kind of a cleaning wipe, then that should work great. Just doing that to remove those allergens. Another big tip is that if you are a makeup wearer, don't fall asleep in your makeup. That causes a lot of other problems on your eyelids, but it is known to trap allergens to the tissue, and that can kind of aggravate the whole response. Tip number 2 is to consider rinsing your eyes with something like an artificial tear. There are many different types of salines and artificial tears out there. I have other videos on that subject if you want to check those out, but just rinsing the eyes with an artificial tear will help kind of drain out any of the allergens that could have stuck onto the tears and onto the eyelids. That'll help rinse those away so they don't get trapped on the eyelid and cause more of that aggressive response. Now, tip number 3 are cold compresses. Now, cold compresses are basically like doing an ice pack for a sore shoulder or a hurt elbow, but that cold will help kind of shrink up those dilated blood vessels and slow down fluid movement, preventing the swelling. It'll kind of cool down any of the irritation, because some people kind of have that initial reaction. They want to rub their eyes really hard when they itch. Don't do that, because if you try to rub your eyes really hard, you break a cell within your tissue called a mast cell. And mast cells, although it feels good to rub your eyes, the mast cells will break open and it actually aggravates the whole response and makes things worse. So yes, don't rub the eyes. Instead, try to use a cold compress because it feels good and it helps bring down the swelling. And now my fourth tip is that you can try some type of an over-the-counter antihistamine eye drop. There are a couple of different eye drops out there. There's really older generations that usually find that are cheaper, but they usually say get the red out, and it's not good to go for those, although it makes your eyes look a little bit whiter. Most of those get the red out drops, they only work for a short period of time and they wear off, and they're almost in some ways addictive because they do make your eyes look whiter for a short time, but then the medication wears off, so you use it again, and then the medication wears off, so you use it again, and it becomes this vicious cycle. So some of my favorites are a medication called Zaditor, another one called Alaway. They're both over the counter and they reduce the histamine response. At the same time, a new one just came out called Pataday that it used to be a prescription only and was fairly expensive, but now it went generic, so it's over the counter and it's a pretty acceptable price. And you can use it either twice a day or once a day, depending on what formulation you pick up. And tip number 5 is to consider some type of oral antihistamine medication. medication. Whether that be over-the-counter options or speaking to your general physician for some stronger medication, these oral antihistamines do often work for eye allergy symptoms as well. But ultimately, and as always, if you are experiencing red, irritated eyes that aren't improving and perhaps you're having vision issues, then definitely go and talk to your local eye care professional. Make sure you're getting checked out, that it's not something more serious going on. So I have the question of the day. Which part of this video did you find most helpful, and what sort of things are you allergic to? Go ahead and leave a comment in the section below. If you'd otherwise like to learn more about the eyelids and eyelid health, go ahead and click or tap the screen over here to the side to check out our full series, or if you'd like to see another cool video from Dr. Eye Health, you can go ahead and click or tap the screen down over here. Again, this is Dr. Allen. Thanks for watching, keep an eye on it, and we'll talk to you soon.